Major funding for these broadcasts has been provided by grants from Madison Realty Capital, New York Community Bank, M&T Bank, AmTrust Title, Customers Bank, Ariel Property Advisors, Capital One Bank, Sterling National Bank, Marks Paneth LLP, Meridian Capital Group. Additional funding has been provided by grants from Amarant Bank, AVR Realty Company, Bank of America Merrill Lynch, Briarwood Organization, B6 Real Estate Advisors, CBRE, Chase Commercial Term Lending, Chase Mortgage Lending, Citizens Bank, Collins Building Services, CPEX Real Estate Services, Douglaston Development Levine Builders, Flushing Bank, Friedman LLP, Handro Properties Handler Real Estate Organization, Hodges Ward Elliott INC, Investors Bank, James D. Kuhn Real Estate Institute at Syracuse University, John Catsimatidis Red Apple Group, Kilroy Architectural Windows, Matone Group, Newmark Knight Frank, Optimum Window Manufacturing Corp., People's United Bank, Rockefeller Group, Rosewood Realty Group, RPW Group, SJP Properties, Stonehenge NYC, TD Bank, Terra CRG, the Merringore Family Foundation, and these friends. Dr. Robert Montgomery, head of the NYU Langone Transplantation Institute, correct?
Correct.
Joined with me a couple of months ago to talk about his life growing up, going to school up at St. Lawrence, right? Mm-hmm. Going to University of Rochester Medical School, a Watson Scholar, a person who traveled around the world, and a person who knew that he had a health problem over the years. So today, Robert's going to continue his story and tell you the change from physician to patient. So let's talk about your late dad and your brothers. Tell me about them.
My dad was a mechanical engineer and did a lot of aerospace work. And at age 50, he developed shortness of breath, fatigue, and he was diagnosed with this disease, cardiomyopathy. At the time, they thought it was from a virus, that he had gotten an infection and it had attacked his heart. And he only lived about 2 years after the diagnosis. And he had quite a few episodes of just dropping dead, cardiac arrest, and getting resuscitated. But the last time, sadly, he was resuscitated, but he had a really bad brain injury from the cardiac arrest, and he was in a chronic vegetative state for about 6 months and then died.
Now, you had said to me in part one that he had said to you, son, don't be scared of dying, right? Mm-hmm.
Yeah, he knew he was on his way out.
Okay, let's talk about your brother.
So, fast forward quite a few years. I'm an intern at Johns Hopkins in surgery, general surgery, and I get a phone call from my sister-in-law saying, your brother just dropped dead water skiing. And obviously, it was a tremendous shock to everybody. He was a marathon runner. He was in great shape. He had never been sick, and he just fell over and died. So we knew then that, there was something up. And he had an autopsy, and I had his heart sent to University of Rochester, where I knew one of the cardiac pathologists because I had been there at medical school. And he examined it, and he said, cardiomyopathy, same disease your dad had. So then we knew that it was genetic. So we got tested. There were 4 boys. I had 3 brothers. And of my remaining 2 brothers, one of them had it and one didn't. And then I was tested during my second year of residency and found to have it, and was at a risk for, sudden death. So they, at Hopkins, where they had invented this new technology, the cardiac defibrillator, implantable defibrillator, they put one of the prototypes from one of the early versions of this into me, implanted it into my abdomen, opened my chest, put
How old were you?
patches around my heart that could shock the heart if I had one of these episodes. I was 29. So, and they told me that your surgery career is over. This is just too much for someone to, have this risk. And I mean, back then, surgery training was sort of like Navy SEALs. It was really intense, 120-hour work week kind of thing. And they were also concerned that some of the equipment in the operating room would electronically interfere with the device and make it go off. Because I was the first surgeon in the world to get one of these implanted, so they didn't know.
What happens with your brother? You said your brother had a heart transplant.
My brother had a heart transplant at age 39, so he just slowly, his heart function deteriorated. He didn't have the rhythm problems where, he would have cardiac arrest. His pump just failed. And so he had a heart transplant 23 years ago. And he's a dentist. He's still practicing and doing great.
So let's talk about what happened, not in September, what happened a couple months before. You said you had a condition.
Yeah, so, kind of like, leveraging technology, the defibrillator, and a new medication that I was on for 20 years that really smoothed out my rhythm and made, some of these life-threatening arrhythmias kind of melt away. I was able to have a pretty normal life. I had
Normal
a family.
life. You traveled around to Madagascar. You traveled around the world. You were in Africa. I mean.
Yeah. I raised a family and, became a transplant surgeon. But every decade or so during that 30-year period, I would have some episode. And then it sort of started to reach a crescendo. So the episode that you're referring to, I was with my family at a Broadway show, School of Rock. And about 20 minutes into the performance, I dropped over. And I woke up, and there were people all around me. I was in the aisle, and they were doing CPR on me. And broke a bunch of ribs. And the show stopped. And they took me to the hospital. And, after one of these episodes, I'm fine. So I was released. Actually, it was the day before my mother's funeral. So they wanted to keep me. I said, look, I can't stay. I got to go to my mom's funeral. But I was in tremendous pain because of these fractured ribs. So things settled down again after that. And then in September, so 3.5 months ago.
Right, September, you go to this meeting, which is interesting because that's the same flight that you met your wife, Denise.
That's right. Yeah, we met 14 years ago when I was going to this meeting, which occurs every 2 years in Italy, in different places in Italy.
And this is a transplantation meeting, right?
It's a transplantation meeting, and it's focused on living donation. So we were at the meeting. My wife went with me, and she performed the last night of the meeting.
Right, because she's an opera singer.
She's an opera singer.
At the Met, all over the world, yes.
So she sang for the whole crew, and we went out to dinner, went back to our hotel room, and I was sitting on the edge of the bed ready to get undressed was the last night. People were starting to leave. And I felt, the palpitations. So I felt my heart starting to race. And I said, uh-oh, Denise. And then she turned around. I was face down on the floor. It was a stone floor, one of these old hotels in Italy. Blood coming out from my face, which smashed against the
Right,
stone.
so you had this heart attack, or whatever we want to call it.
Yeah, cardiac arrest.
Cardiac arrest. That was the first time.
That was the first time. And then, so I stopped breathing. I went still. I looked like I was dead. It takes about a minute for this device to fire. And so then suddenly my body, jerked, and I woke up. And then over the next 3 hours, it happened 3 more times. So we knew something had changed. The substrate had changed.
So you go to the hospital, and what happens?
I go to this, we were in this small town in Italy. I go to this little hospital. As soon as we walked in, I knew more about my condition than anybody in the hospital. They kept me overnight, put me on drips and everything. And next morning, I just said, look, I've got to leave. I'm sorry. And so I signed out against medical advice. But the Italians are so amazing. They are so compassionate. They, rather than just saying, okay, goodbye, they gave me these syringes full of medications that could resuscitate me, and left an IV in my arm. And one of my friends flew back with me, one of the doctors, on a commercial flight back to the States with a handful of syringes in case I dropped over.
Me, I mean, you're the person who in 2016 went to NYU to start the Transplantation Program Institute. Some of your friends, transplant surgeons from around the world, said, you need a transplant, but don't do it at NYU, right? That was the basic comment, because Cedars of Sinai has a good program, Cornell has a program. You came back. Were you admitted immediately to NYU?
No. At that point, things had stabilized and I was okay. So I contacted our heart team, and we had just started doing heart transplants at NYU last January. So the program wasn't even 8 months old, because this happened in September. And so I, let everybody know that, look, something's changed. This happened to me 4 times. Next time I'm not going to be so lucky, right? End up like my brother. Please, let's sit down and talk. So the heart team came up to my office and we sat down. They looked at me and they said, you need a heart transplant. And I said, I need a heart transplant. And, it was like a lightning strike. It was so clear, which was a good thing.
But as the problem is, you may need a heart transplant, but you were saying to me, you don't get a heart transplant overnight.
No.
So how do you get a transplant within five?
Well, so it took a week or so to get me prepared for a transplant, because you have to be sure that all the other systems in the body are okay. Then they admitted me to the hospital, and were able to assign a status to me, a high priority status, because I had life-threatening arrhythmias. But they told me it could take months, because hearts are matched by your blood type and your size, and I'm a big guy and I'm the most common blood type, which is a bad thing, actually. And so they were like, could be a really long time, and I could die, in waiting, like a lot of people do. And they said, they explained, and I knew, of course, the different options. And I said, look, I'll take a heart from somebody who dies from a drug overdose, who has hepatitis C, because we had just started a program where we would put organs in from donors who had hepatitis and the recipients who didn't have hepatitis. and then treat the recipient, because we now have a cure for hepatitis C. So I said, I'll take anything.
So how many days did it take before they found the
It was only, it was less than a week.
So less than a week, a young 25-year-old person who had died of a heroin overdose with a needle in his arm, that heart comes to NYU.
Right.
Let's talk about the surgery briefly.
Yeah, so you know, I got a phone call from the heart surgeon, and he says, look, you know, it's amazing, but as if you incarnated your donor, you know, with the description you gave of, you know, what you were willing to take. So he said, are you willing to, you know, are you still willing to take this? I said, of course. Knowing that I would infect myself with, you know, hepatitis C. But this was my shot, you know.
So when was the surgery?
Surgery was on September 20th.
Now, I saw you 3 weeks later making a presentation at the NYU board meeting.
Yeah, I shook it off pretty well.
But let's talk a little bit about the surgery, and let's talk about what you have to do afterwards, and also about the testing, because your children, as you were saying, 2 of them have the gene, as they would say.
Yeah, that's right. So after my brother died, so that was in 1987. He was an attorney out in Seattle and had a lot of colleagues and friends who were of means, and so we started this foundation and raised a bunch of money to help support research groups that were interested in uncovering the genetics of cardiomyopathy. And so one of them found the gene for our family from the blood, you know, that we had sent from our family. And so one day, my cardiologist, about 6 or 7 years ago, called me up and said, "We think we found the gene, and would you come in and let's talk?" So, you know, that's kind of toxic knowledge. I mean, I knew I had the disease, but I didn't know about the kids. There's a 50-50 chance with each child. But I knew, because my life had been saved by a defibrillator, that there was something we could do, and it was, you know, we needed to know who had it. So my kids got tested, and they both had it, and they both got defibrillators, and my 2 nieces, my brother who dropped dead, his 2 children got tested, and they had it, both of them, and had defibrillators placed.
Now, we were saying, what can you do if you have it with the embryos?
Well, so now there is the option of, you know, you can do in vitro fertilization and then let the embryo grow to a certain point and then remove one cell from the embryo and test it for the mutation in the gene. And then only implant the embryos that don't have it. So that's an option in a way to kind of end this cycle.
Let's talk about how your life has changed since the surgery.
Well, I mean, the surgery, you know, so I've had these different...
You've had a number
periods of my life, right? But I've had a chronic disease that I've known I had since I was 29 years old, right? But I would have periods of, you know, sort of stability, was very productive, you know, lived a full life. And then I'd have these moments where the wheels would fall off, right? But the heart transplant was a transition into something completely new. Because you're trading, you know, one set of issues for another. It's a trade-up, for sure, because you're going to live. But now you've got to take medications to suppress your immune system. You have to get biopsies of your heart. You know, it involves a lot. And, you know, I think that it was a more dramatic sort of patient experience, and probably allowed me to distill out more, what it's like to be a patient, and to also realize what's important in terms of being a physician, taking care of a patient.
So what have you learned?
I mean, I think one of the really important things is that physicians have to be very careful. So you have to do everything as if it matters, because you never know when it's going to matter. And you never know when something's going to be really important to that patient. So, I mean, I'll give you a couple of examples. So one, which happened 2 days ago, I got an email from, I had a cold, and the infectious disease doctor who looks after the transplant patients sends me this email, how are you doing? You feel any better? We tested you and you have this virus that causes a common cold, and this is what you should expect, and this is what works for my patients, and if you have a fever or this, make sure you call me. That made all the difference in the world to me. That somebody was kind of watching over me, and it was just the right thing at the right time. I'll give you an example of the opposite. So one of the medications that I'm on, the immunosuppressive drugs, causes a tremor in just about everybody who takes it. 95% of the people, it doesn't matter, right? They just get used to it. But I'm a surgeon. It matters. So I started looking around the country to try to find an alternative drug, that I could substitute for that long term so I can get back in the operating room. I called one of the luminaries, one of the experts, a heart surgeon, because I'd talked to a number of them. I called him and I said, look, this is really important to me. I'm a transplant surgeon. Surgery is my life. This is the most important thing to me. And I wanted your advice. Is there another alternative? And he said, well, honestly, I think you just need to live with this. And, you can do something else. And to him, probably that was like a nothing kind of thing, right? In his busy day, he'd probably seen 10 or 15 patients that day. He didn't realize the impact that would have on me. He just wasn't conscious. As a physician, you have to be conscious. You have to be conscious of everything you say and do, because it can really be impactful. And that has become very clear, being a patient, watching my physicians, watching my surgeons, And when you're a patient, you sort of rise and fall on what people, who are in the know say to you or do to you. And it's all important.
Now, you went over there, as I said, in 2016. You went to a place that was doing what, 50?
Less than 50 transplants, just kidney and liver.
And today?
Last year we did almost 300. And we expanded kidney and liver. We started a bone marrow program. We started a heart transplant program. I was the 25th heart transplant. We started last January, as I mentioned. Same time we started a lung transplant program. So there's just been this tremendous growth.
Now, when you interview medical students today, what do you say to them about transplantation?
I tell them that I'm a walking, talking example of the miracle of transplantation, right? I probably wouldn't be here now. It's incredible. Think about it. Not only that, I got a heart, which tells one of the most important stories of our lifetime in terms of medical advancement, which is we now have a cure for hepatitis C, which has affected so many people and causes their livers to fail or to get cancer. And now you can cure it 99% of the time. So yeah, I mean, these are miracles. These are things that we have witnessed. My dad didn't have a shot at a heart transplant.
Right, because I remember in part one when your dad said to you, don't be scared of dying.
Right.
Okay? And he couldn't even get a transplant because he was 50 at that time.
Right.
And you were 58 when you had the transplant.
Yeah. That's right. There was nothing for him. There was no defibrillator that hadn't been invented yet. There weren't drugs to help control the rhythm that I benefited from. Those weren't in existence. He had nothing. You know, he was just going to die. Over the last 40 years, look what's happened.
Look,
and I'm a
I mean,
testimonial to that.
Let's put it to you this way. I've been involved with the NYU Langone Medical Center for probably a quarter of a decade. They had no programs. They had nothing like this. And now, due to your efforts, the work of Bob Grossman, you know, Ken Langone, and everybody over there, they've created a fantastic transplantation program. And I don't think there's a better example of a person to lead it than this transplant patient. And thanks for being here again today.
Thank you so much.